Multiple choice questions, MCQs, on the following themes related to children with deafblindness. Teaching methods of deafblind children. Educational barriers faced by deafblind children. Suitable teaching learning materials, TLMs, for deafblind children. Classroom strategies for teaching deafblind children. 1. Which of the following is a commonly used teaching method for deafblind children? A. Lecture method. B. Tactile method. C. Audiovisual method. D. Dictation method. Answer: B. Tactile method. 2. Tadoma method involves A. Reading Braille. B. Speaking through sign language. C. Touching lips and throat to understand speech. D. Using a hearing aid. Answer: C. Touching lips and throat to understand speech. 3. Which method helps deafblind children communicate through finger spelling into the hand? A. Total communication. B. Tadoma. C. Tactile sign language. D. Braille. Answer: C. Tactile sign language. 4. Which language system is adapted for tactile communication with deafblind learners? A. American Sign Language. B. Spoken Hindi. C. Braille. D. Tactile sign language. Answer: D. Tactile sign language. 5. In deafblind education, total communication means A. Using only speech. B. Using only signs. C. Using all possible modes of communication. D. Writing only. Answer: C. Using all possible modes of communication. 6. A calendar system used for deafblind children helps in A. Auditory training. B. Visual stimulation. C. Daily routine scheduling. D. Language translation. Answer: C. Daily routine scheduling. 7. Coactive movement teaching involves A. Teacher passively observing the child. B. Child imitating another child. C. Teacher guiding child's hands in tasks. D. Giving rewards for behavior. Answer: C. Teacher guiding child's hands in tasks. 8. What is the primary goal in teaching deafblind children? A. Memorization. B. Independent communication and functional skills. C. Fast learning. D. Scoring high marks. Answer: B. Independent communication and functional skills. 9. Which approach involves consistent repetitive experiences for deafblind children? A. Play therapy. B. Multisensory approach. C. One-way instruction. D. Punishment method. Answer: B. Multisensory approach. 10. Which of the following is a communication aid for a child who is both deaf and blind? A. Overhead projector. B. Radio. C. Tactile signboard. D. Whiteboard. Answer: C. Tactile signboard. 11. The tactile method primarily uses which sense? A. Sight. B. Hearing. C. Touch. D. Smell. Answer: C. Touch. 12. Which of the following is not a suitable teaching method for deafblind children? A. Verbal lectures. B. Tactile signing. C. Object symbols. D. Coactive movement. Answer: A. Verbal lectures. 13. What is the most effective strategy for early intervention in deafblind children? A. Wait until school age. B. Immediate multisensory stimulation. C. Isolate them in a quiet room. D. Use only vision training. Answer: B. Immediate multisensory stimulation. 14. The use of object symbols in teaching helps deafblind children to A. Count numbers. B. Understand abstract concepts. C. Communicate needs and routine. D. Improve handwriting. Answer: C. Communicate needs and routine. 15. Tactile finger spelling is mainly used when A. The child can see but not hear. B. The child can hear but not speak. C. The child is both deaf and blind. D. The child has a physical disability. Answer: C. The child is both deaf and blind. 16. One of the major barriers to education for deafblind children is A. Overcrowded classrooms. B. Lack of interest. C. Dual sensory loss. D. High intelligence. Answer: C. Dual sensory loss. 17. Deafblind children face challenges primarily due to lack of A. Uniforms. B. Textbooks. C. Communication methods and trained staff. D. School fees. Answer: C. Communication methods and trained staff. 18. Barriers in mobility and orientation are due to A. Lack of braille. B. Vision and hearing loss. C. Bad behavior. D. Lack of games. Answer B. Vision and hearing loss. 19. Which is a psychological barrier often faced by deafblind children? A. Inability to read fast. B. Low self-esteem due to isolation. C. Too many toys. D. Fear of exams. Answer B. Low self-esteem due to isolation. 20. Lack of appropriate assessment tools leads to A. Early diagnosis. B. Overestimation of skills. C. Misdiagnosis or late intervention. D. Advanced curriculum. Answer C. Misdiagnosis or late intervention. 21. A major infrastructure barrier in schools is A. Clean classrooms. B. Inaccessible buildings and environments. C. Online classes. D. Large playgrounds. Answer B. Inaccessible buildings and environments. 22. Social stigma regarding deafblind children can cause A. Better treatment. B. Enhanced learning. C. Exclusion and limited opportunities. D. Motivation. Answer C. Exclusion and limited opportunities. 23. Lack of teacher training in deafblind education leads to A. Enhanced teaching skills. B. Better classroom discipline. C. Inability to address individual needs. D. More exam success. Answer C. Inability to address individual needs. 24. Inadequate TLMs for deafblind children result in A. Faster learning. B. Better concentration. C. Inaccessible lessons and reduced engagement. D. Improved homework. Answer C. Inaccessible lessons and reduced engagement. 25. Language barrier in deafblind education arises due to YIST. A. Poor textbook printing. B. Dual loss in hearing and vision. C. Expensive schools. D. Lack of interest. Answer B. Dual loss in hearing and vision. 26. Which of the following is an ideal TLM for deafblind learners? A. Textbook with small font. B. Audio CD. C. Tactile graphic with braille. D. YouTube videos. Answer C. Tactile graphic with braille. 27. Object symbols used in teaching help in A. Memorizing poems. B. Understanding time. C. Representing people, places, or events. D. Drawing pictures. Answer C. Representing people, places, or events. 28. Communication boards for deafblind learners should be A. Audio-based. B. Visually appealing only. C. Tactile or raised symbols. D. Written in cursive. Answer C. Tactile or raised symbols. 29. A suitable classroom strategy includes A. Keeping child isolated. B. Group discussion. C. One-on-one interaction with tactile input. D. Loud voice instructions. Answer C. One-on-one interaction with tactile input. 30. Which is a suitable classroom seating arrangement for a deafblind child? A. Backbench. B. Random seating. C. Near the teacher with minimal distractions. D. In front of a noisy window. Answer C. Near the teacher with minimal distractions. 31. Which assistive tool allows deafblind students to read and write? A. Microphone. B. Telescope. C. Perkins Brailler. D. Digital clock. Answer C. Perkins Brailler. 32. Multisensory materials used in deafblind education include A. Smell and touch-based toys. B. Bright lights. C. Audio CDs only. D. Whiteboard markers. Answer A. Smell and touch-based toys. 33. Which is a tactile reading material for the deafblind? A. Flashcards. B. Tactile books. C. Posters. D. Mobile screens. Answer B. Tactile books. 34. Personalized daily schedule using real objects is known as A. Talking timetable. B. Symbolic communication. C. Object calendar. D. Flashcard routine. Answer. C. Object calendar. 35. A safe learning environment for deaf-blind students includes A. Too many decorations. B. Consistent layout and organization. C. Frequent rearrangement. D. Loud announcements. Answer. B. Consistent layout and organization. 36. Which material is not suitable for deaf-blind learners? A. Audio storybooks. B. Tactile puzzle. C. Object symbols. D. Texture-based materials. Answer. A. Audio storybooks. 37. Tactile maps can be used to A. Tell stories. B. Teach geography and spatial awareness. C. Paint landscapes. D. Count objects. Answer. B. Teach geography and spatial awareness. 38. What kind of assessment method is best for deaf-blind learners? A. Written tests only. B. Tactile-based performance tasks. C. Group oral exams. D. Visual recall. Answer. B. Tactile-based performance tasks. 39. Educational TLMs for deaf-blind learners must focus on A. Speed. B. Sense